first started getting thoughts of being a doctor very young. My mom even has a coloring book when I was in kindergarten of what you wanted to be when you grew up, and I drew a doctor. Yeah, a DO is a doctor of osteopathic medicine, so a little bit different than an MD, which is a medical doctor. We still go through the same amount of training. It's still 4 years of undergraduate school, 4 years of medical school, and then for family medicine, 3 years of a family medicine residency. There's some differences in the training of the medical school in particular. Many of the classes are the same, but then in addition to the usual anatomy, physiology, and things like that, we get 4 years of manipulative therapy. So similar to chiropractic therapy, but kind of with the doctor along with it. We get taught kind of more of a holistic approach to the patient. Lots of doctors do that on their own, but in our training we get taught that we have to look at the patient as a whole, all physically, emotionally, and spiritual aspects of that person. Growing up with my parents as physicians, especially in a small community, it was a town of about 20,000 people, and seeing them care for their patients and them being appreciated, I think really helped. And people bringing cookies by the house, and them just really being able to care for these families the same way, and getting to know patients on a personal basis. So if I can leave that patient with knowing more than they did before about what their ailment was or their illness, then I think I've accomplished something. So I think education is definitely going to be a key part of what I should be doing every day.